to you by Health Diagnostic Laboratory, Inc.
Welcome back to the broadcast. Okay, for the last few months, we've been telling you about the Health Diagnostic Lab's detailed blood tests that can tell you all sorts of things about your health and the future of your health. So Dr. Tara Dall joins us now for a little question and answer session. I love that we're doing this. So you brought some people in who've had their testing done.
Right.
And
actually, I don't know any of the people that are here. They just kind of wandered on in, and they've all had testing done. And so what we're going to talk about today is really impromptu. Nothing's been staged in any way. We're just going to answer questions, talk about the questions people have when they get this type of report, and hopefully all walk away a little bit more knowledgeable.
So let's start with Carol here. You've got your test results there, yes. Carol, and so you've gone over them, and you had some specific questions?
Well, yes. With regard to the APE genotype and the risk of Alzheimer's, I'm wondering what, if you tend to lean toward high risk, what the benefits of things like exercise may be, or types of exercise, and also the effect of carbohydrates, artificial sweeteners, and even sugars. If you can make any comments if that has an effect.
Diet
Absolutely.
And lifestyle,
Can I take a peek at your report while we're doing this? Okay. So Carol's asking a question about the ApoE genotype, and that's something where it's genetic, it's DNA, there's nothing we can really do about it. You have what you have. And he happens to have this 4 mutation, and he has a 4-4. Now, we generally do this for cardiovascular risk assessment, but yes, you're correct that there is some increased risk related to Alzheimer's when you have a double mutation like this. So you're really, it's important to talk about what can I do preventatively. Exactly. And certainly things like exercise, proper diet is really excellent. In fact, when I glance at the rest of your report, I see that you actually may have some evidence of some insulin resistance. And insulin resistance can also be a driver of Alzheimer's risk. So if you can find ways to reduce the sugar, get rid of the carbohydrates in your diet, as well as, keep an optimal body weight by, exercising, that also will have some great preventative measures. I really like it when people use, good doses of omega-3 too. That really helps protect the brain. So usually when people have a 4-4, I say, make sure that you're getting maybe an omega-3 supplement in addition to eating a good amount of salmon and herring and stuff like that.
I feel like we're on one of those psychic shows, where you're like doing readings for everybody, but really, that's what the advanced testing is. It gives really such
allows
a better
us to
view.
Personalize. Absolutely, absolutely. So I think there are definitely some things to do, and also want to just point out that just because you have this genetic mutation does not mean you're going to get Alzheimer's disease, you're going to get diabetes, anything like that. It just increases risk, and it really gives us a window into what we now can do to really be preventive. So I don't want anyone kind of going home depressed thinking they've got some life sentence that's just already been laid out for them. There's so much that can be done by changing lifestyle. And I think based on those insulin-resistant markers for you, you need to tell me, do you eat sugar in excess right now, or you...
In excess right now.
You eat sugar in excess right now. So in your case, this would be maybe a simple fix by just getting rid of some of those sugars in the diet, especially the stuff that's like pure sugar, the obvious sugar sources.
Sugar is
really
a toxin.
Important. It really is. It's a toxin, and it's a big-time toxin to our brain. And certainly, we want to do everything we can to protect our brains.
But the artificial sweeteners aren't necessarily a great alternative, or?
So artificial sweeteners. See, the problem with artificial sweeteners is they trick our body into feeling like we're getting sugar, and so some of that abnormal insulin response that you can get from sugar can still happen even with the artificial sweeteners. So you might not be getting the calories that you'd be consuming from sugar, but you're still making your body have this response by triggering this excess insulin, and that can cause problems. Artificial sweeteners, too, can have other effects sometimes, can cause some inflammation and other things that we really... It's better if you can eat raw food and real food versus, artificial.
What if it's a natural sweetener like stevia? Something
so if you're going to do it, that would be a better way to go. So stevia or Truvia. But ultimately, if you can avoid wanting that sweet taste, that's probably going to be, better than anything else.
Let's have Carol move the mic back behind him, because I think we have someone else there with test results. Hi. What's your name?
Jamie. I got my results back, and I saw that I have the genetics for heart disease, and I wanted to know what niacin played, or how niacin played a role in it.
Okay, now I had the benefit of, we chatted a little bit earlier, so when she talks about the genetics for heart disease, you basically have a very high, what's called a lipoprotein little a, and this is a really sticky particle that really has nothing to do with diet and exercise. It's one of those things that, you're pretty much born with it. If we would have checked you when you're 5 years old, we would have found out you have a high LP little a. Now, LP little a can run in families and can be associated with early heart disease. And you're right to ask the question about niacin, because niacin's really the one thing, it's a B vitamin, but it's actually the one thing that can lower Lp(a). Very few other medications will. And so it's something definitely to consider. I use a lot of niacin in my medical practice, especially for people that don't want to be on other cholesterol drugs and other things. I think niacin has a fantastic effect on lowering those bad particles, the LDL particles and the ApoB particles. And in somebody who has a high lipoprotein a like you, that could be a really reasonable thing to consider. Niacin really sometimes gets a bad rap. There's been some recent news saying it doesn't have any benefit, but most of those studies were really looking at niacin's ability to have benefit in somebody with a low HDL cholesterol. But I don't even use niacin for that. I really use niacin for lowering the ApoB, the LDLP, and those Lp(a) particles. So and certainly big role for that still.
The big question is, would she have known about this had she gotten a traditional blood test?
Yeah, absolutely not, because everything else on her panel was really, picture perfect. So,
yeah, and so there it is.
And you're young, obviously, and you wouldn't really be thinking about heart disease so much, when you're young.
That is the reason to have that advanced testing. I wish we had more time, because I know everyone has some questions, but we'll have to revisit this again.
Sure, next week.
I think it's great that we're able to educate everybody about this advanced testing, how important it is, and the fact that it's a simple request for from your doctor.
Absolutely.
To get the testing done. Everybody can have it done. So thank you so much for being here,
You're
Dr.
very
Tara
welcome.
Dall with Health Diagnostic Labs. And you can find more information about Health Diagnostic Laboratory by going to our website at thebroadcasttv.com. And we're back in a moment with more.